2025 has been quite the year. We've covered so many cool things. It was hard for me to choose some of our top moments, but let's take a look back on 2025 and the episodes where we covered the female brain. Welcome back to Wellness Fixes the Pod. I'm your host, Dr. Kelsy Vick, a board-certified orthopedic doctor of physical therapy and a pelvic floor physical therapist. And one of my top favorite moments, and one that has really actually changed how I am going to approach different goals and really manifestation tactics in the new year, was our episode on Lucky Girl Syndrome and the neuroscience behind Lucky Girl Syndrome. What's fact? What's fiction? We took a deep dive into the research and learned all there is to know about the truth behind Lucky Girl Syndrome and how to apply the neuroscience behind Lucky Girl Syndrome into our own lives. Speaking of the brain, let's talk about a very key component in Lucky Girl Syndrome and in just filtering out certain information that we're presented with every day. Let's talk about the reticular activating system, which is like your brain's filter. So it's a network of nerve pathways in the brainstem, and it acts as your brain's gatekeeper for information. So we are presented with so much information throughout the day and moment by moment. Even the temperature, even little particles of air that pass over us, we are presented with all of that information. And the reticular activating system helps us decide what to focus on. So when you affirm that I'm lucky or good things happen to me or opportunities come my way, the RAS actually activates. Your brain starts scanning for evidence that confirms this belief. You notice opportunities, connections, and positive moments that you might have previously filtered out. So there's a power in this. You do actually notice more opportunities and more good things that come your way when your RAS is cued for this Lucky Girl Syndrome. However, there's also a little bit of a pitfall in that it can also selectively filter out opposing views to that Lucky Girl Syndrome. So it's this selective attention where you notice more opportunities and are ignoring any threats that go against that I am lucky, good opportunities come my way affirmations. So the bottom line, here's what we know from neuroscience about Lucky Girl Syndrome. Your thoughts literally change your brain structure. Positive affirmations activate reward centers and can shift attention. So I'm a lucky girl can work if you understand it as I'm going to intentionally notice the opportunities that can help me create my own luck through the actions that I'm going to perform. But it won't work if it means I'll sit back and good things will come to me. It has to have action. The most powerful version of Lucky Girl Syndrome combines positive affirmations, positive mindset with action. So you can train your brain to be more resilient, motivated, and opportunity conscious through activating certain brain regions that make you more goal-driven, more pursuit-driven, more reward-driven, and also alerting certain parts of your brain, the filter of your brain, to see different opportunities, but also realize that with some of that optimism comes a little bit of a dampening of some of the bad news or contradictory evidence that we might get presented with. And always remember that mindset needs to be followed by action. It's not mindset alone. If you missed that episode, it was episode 84, but some of the key components we covered and the truth behind Lucky Girl Syndrome that we covered was the fact that you can actually shift your brain and shift your focus to notice more goals and more opportunities. That's true. However, you always have to follow that shift in focus with action. It's not just magical. It can't just be wishful thinking and good things come your way or lucky things come your way. You have to actually follow that shift in focus, that shift in opportunity with action. Another popular episode this year, and one of my favorites, was episode 79, where we covered how the female brain uses motivation and discipline throughout different parts of our cycles. So let's start with motivation. Estrogen starts low and rises throughout our follicular phase. So if estrogen amplifies dopamine, we expect dopamine and therefore our motivation levels to also increase steadily throughout that follicular phase, which is that days 1 through 14-ish. During the ovulation phase, that is our peak reward system activity. Imaging studies have also shown that our brains light up more in response to rewards during this phase. And then lastly, our luteal phase. As estrogen drops in our luteal phase, so do our levels of dopamine. We expect decreased motivation, requiring more effort to feel rewarded during this phase. So overall, in this luteal phase, we expect to be a little bit less driven and less enthusiastic overall about pursuit of any sort of goals. So that's the motivation side of the equation. Let's look a little bit into the discipline side of the equation. Discipline is a top-down approach. And anytime we talk about top-down or bottom-up, when we're talking about neuroscience, we really are talking about the central nervous system, primarily the brain's executive control over all of the different processes that happen below. So when our dopamine's low, our prefrontal cortex can actually override it and say, oh, I know you probably have low motivation right now, given your dopamine levels are a little bit lower, but we have to complete this task. That's where that top-down approach comes in. That's where the command center, the CEO, really has to step in and say, I know you might not feel motivated, but you have to be disciplined in order to accomplish this task. So the prefrontal cortex sends brain signals down the pathway to help regulate other brain regions to produce the action that we want, or really that it wants. Since what we want might differ from what our prefrontal cortex wants or knows that we want long term, but we might not want in the short term. So we can actually override our brain's impulses and signals when motivation is low. The discipline headquarters in the dorsolateral prefrontal cortex, which is just fancy terms for the location in the prefrontal cortex. So you can think of the prefrontal cortex as just that command center, that CEO. And there's a lot of different regions within that prefrontal cortex that are involved in discipline. All of these fancy terms make it sound more complex, but just think of it as the command center. So the discipline headquarters are in the dorsolateral prefrontal cortex, and that's a specific area within that command center, that CEO, that structure that can help us override some other signals that we're getting. So the discipline headquarters have a few jobs, one of them involving working memory. So it allows us to hold our goals in mind when motivation is low. It allows us to switch strategies. So executive planning, if plan A is not working, it allows us to switch strategies to plan B. It offers inhibitory control. So stopping yourself from doing something you know you shouldn't be doing. And it creates structure. So it's involved in planning and organizing. So it helps to create that structure, especially when you don't feel like it. So another part of the prefrontal cortex, the ventromedial part, evaluates short-term pleasure versus long-term consequences. So this is where we might be a little bit more tired or just low motivation working on a certain project. This is the area that sort of evaluates, is this short-term want or desire going to help me reach my long-term goals? So it cues us to say, hey, that rest or that nap might not actually help you reach the goal that you have in mind of finishing this project and getting it back to school or your boss or whatever deadline you have set for yourself. So it evaluates that short-term pleasure versus that long-term goal you have for yourself. And lastly, when it comes to discipline, the brain has an alarm system, the anterior cingulate cortex, if you care about location or names of things, but it's basically the alarm system. And it sends an alarm when what you are driven or not driven to do, as determined by dopamine, is in conflict with what you should do as determined by your goals. So after that evaluation process, if there is this disconnect, this alarm system kicks in to say, hey, this is not going to help you reach those goals. Let's reevaluate the situation. So the alarm system sends signals back to the command center to say, we need you to step in here with a little bit of discipline. So let's talk about it in practice a little bit, just to get a more well-rounded picture of how discipline works within our cycle. So let's say you're in your luteal phase, dopamine is low. You're feeling low motivation, but you have a big project due. The anterior cingulate cortex senses this disconnect, so it's the alarm system. It alerts the CEO or the command center, the prefrontal cortex. The prefrontal cortex sends inhibitory signals to stop avoidance behaviors. So you're trying to avoid that project. This prefrontal cortex, the CEO, the command center, overrides that to inhibit some of those lazier things that we might want to do when we have lower dopamine and lower motivation. The prefrontal cortex also continues to keep the long-term goal recognition part of the brain online to remind you, like, hey, remember this goal you have for yourself or this goal that you want to accomplish. Remember that this current momentary want or desire that you have is short-term, where that is your long-term goal. And then lastly, the brain overrides low motivation and relies on discipline to accomplish the task. So how can we maximize both motivation and discipline throughout our menstrual cycles as women? In the high estrogen phase, the late follicular to ovulation to a little bit of early luteal, we can approach opportunities. We can create a structure to rely on later when motivation's low. Sometimes creating that good solid structure to be more disciplined with later on can really help. We can take on new creative and challenging projects. And when dopamine is high, let motivation lead, but also use discipline to narrow our focus, build habits, and prevent impulsive decisions. In those lower estrogen phases of our cycle, we can rely more heavily on discipline. Understand it might take more of that top-down effort. So if you're having trouble overcoming that barrier to start that task or to finish that task, just give yourself a little bit of grace, knowing that your brain is actually trying to work through that. We're trying to get that command center on board to override some of those impulses that we have to maybe be a little bit more lazy or lean into some of those desires that we want that might not help us reach those long-term goals. So it's a way to just give yourself a little bit of grace too by knowing how your brain's working and how your hormonal physiology is working as a woman. In those lower estrogen phases, you can also let discipline lead and use small strategies to increase motivation. So breaking up large goals into small attainable goals, that way when you accomplish a goal, you accomplish a task, that dopamine's going to elevate anyway. So that's that bottom up approach. You're doing a behavior that is naturally going to elevate dopamine no matter if you're in that lower estrogen phase. You can also exercise, and you might have to lean more on extrinsic rewards or external rewards in order to feel more motivated during a certain task. In this lower estrogen phases, so again, that early follicular phase, that late luteal phase, you can focus on current routines rather than trying to build and maintain new ones. That's a follicular phase Kelsy thing to do. Build new routines, set goals, set reminders, really structure her day in the most efficient way possible. And then luteal phase Kelsy is like, oh my gosh, what was I thinking? There is no way I can complete all these tasks in the day. And that's okay. If you struggle with this, maybe try and stick to your current routines rather than creating new routines on top of that. You can use external rewards and structure more and be patient with yourself because your brain's working a little bit differently. Some of the key components. Motivation is high early on in our cycles, partially due to the increase in estrogen, which amplifies dopamine. Discipline kicks in during the latter part of our cycles, and we should give ourselves grace if we notice ourselves having to climb over more mental barriers to accomplish certain goals or tasks during that phase, knowing our brains are trying to work through their processes in order to override our current pleasures for those long-term goals that we have for ourselves. Speaking of the female brain and goals, we also covered the neuroscience of consistency and goal setting in podcast episode 80 and why we find it easier to stick to certain goals compared to others. Picturing our lives without that goal or failure of that goal really helps us to promote consistency in pursuit of that goal. The stronger that pull is to live with that goal, the more consistent you will be with accomplishing that goal. So taking it back to last week, when we learned that we have an alarm system within our brains that when it senses a disconnect between our long-term goals and what we currently want to do, so maybe short-term pleasures, so let's say exercise, long-term goals, you want to exercise, you want to be someone who exercises, you want to be someone who's able to move in the best way they can for the longest they can. But right now, you really want to just sit on the couch and veg and watch your favorite show. That alarm system will sound, letting your brain know that, hey, currently she wants to do something that is not in alignment with her long-term goals. Can you use discipline to override? Can you use that CEO, that command center, the prefrontal cortex, to override what she really wants to do, to remind her that she does have these longer term goals, that what she wants to do short term is not going to help her reach those long term goals. So for me, with movement, there is a greater pull. There's a greater disconnect because for me, movement is not just short term goals of weight loss, but it's this longer term goal, this longer term value, this identity of who I am. I am a mover. I am someone who values movement for my whole lifespan, for not only myself, but also my family and those that I love, to be able to interact with them in the way that I want, to be able to do the things that I want. So movement is a part of me. Movement is part of my identity. And because of that, anytime my short-term wants or desires go against my long-term goals of being a mover or being someone who values movement, that alarm system will sound. And I'll feel a greater pull to get my butt up, knowing that I view movement and exercise as sacred and part of my identity. So I view movement in that long-term framework. And because of that, my alarm system will sound super loudly to let me know right now, hey, Kelsy, your short-term desires and pleasures are not lining up with those long-term goals. So my command center will be cued to override my desire for those short-term pleasures to be able to put into action things that will help me reach my long-term goal of being a mover for life. So think about whatever you're consistent in. Is there a deeper emotional pull that you feel if you picture your life without accomplishing that certain task? If it is something like, I'm so good at cleaning the house or making my bed, something that seems pretty mundane and ordinary, but if you feel better about yourself, you're someone who values a clean house, values a clean home, or you grew up in a home that possibly wasn't that clean. And because of that, you want to reverse that, where you have this draw to where you picture your home growing up as super cluttered and you have a deterrent towards that home and want to create a clean home. Whatever it is, think about what you're consistent in and see if one of the reasons that you're consistent in it is because if you picture your life without it, you feel this greater emotional pull towards that long-term goal. So let's dive into the fun female brain sciencey part of it all. So we mentioned the anterior cingulate cortex, which is the part of our brain that's that alarm system. It weighs our current want-tos, our pleasures, with the long-term goals that we have for ourselves. And if there's a disconnect between those, an alarm will sound to help us override what we want to do for what we have to do or should be doing. But what we didn't mention last week was that alarm signal and that alarm sound can have varying ranges of intensity based on the emotional and motivational significance of that goal. So, how much does this matter to the person's core motivation and values, their self-identity, their long-term goals? It starts to integrate all of those things to decide the intensity of that alarm. Then it signals our top-down discipline pathways that helps to override what we want to do and replace it with actions that we should be doing to help us reach those long-term goals. The alarm system in the anterior cingulate cortex is extra activated when your goals involve protecting, maintaining, or improving certain relationships, sense of self or identity. I am a mover. That is who I am. So that is a sense of myself. Significant loss or failure. So disappointing or failing people you care about, or a loss of love, status, or security. So picturing your life without the goal that you want to accomplish is a way to help improve consistency towards that goal. It basically helps us evaluate high stakes versus low stakes conflicts and our emotional and motivational attachment towards them. So for different actions and goals, people might have different alarm sounds. Now, think back again to what you're consistent at and reflect on why. Is it solidified in your brain because accomplishing that goal or task has high significance and motivation to you? Can you picture your life not accomplishing that goal or task? And do you have a high emotional response towards that imagery? Now think of something you want to become more consistent with, or a goal that you have for yourself. How can you utilize how your brain works to maximize that alarm system that will sound when you veer from the course? Can you tie it to your identity? I am someone who versus I am someone who is trying to. Not the same. You want to tie it back to your identity. Is there an emotion you'd like to tie to that goal to create that greater pull, that greater intensity of that alarm system? And finally, looking at how it might disappoint future you or someone you love if you fail to accomplish that goal or fail to do that task. So using neuroscience and our brains in order to realize why we are consistent with certain things and why we aren't consistent with certain things can help us understand who we are as people, but also help us to navigate different goals that we have trouble sticking to. This one was one of my absolute favorite episodes and will be hugely important as we start to look at goal setting into the new year. So some of the key components we found during that episode: in order to be consistent with certain goals, it helps to have a large emotional pull to that goal or to failure of that goal. It helps if we can tie that goal to a piece of our identity and who we are. And the intensity of the alarm that sounds when we perform actions that are against or contradictory to that goal depends on how significant that goal is to us, that emotional pull, or how tied it is to our identity and who we are. Every year around Thanksgiving, I do an episode on gratitude. So I love chatting about gratitude and the neuroscience behind gratitude and a gratitude practice. We always cover some of the landmark studies of gratitude, but this year we also added some additional new research on gratitude. So when we talk about the science of gratitude and how our bodies benefit from gratitude, let's start with the brain changes that actually occur with gratitude. So with a normal gratitude practice, we have increased dopamine release within our brains, which leads to an increased activation of that motivation and reward system. We have increased serotonin levels, so an improved emotional stability and well-being. Oxytocin activation, so stronger social connections and reduced social stress. fMRI studies have also shown activation in brain areas involved in judgment, empathy, decision-making, emotional processing, and stress regulation. So these changes last for a long time, even after a gratitude intervention. So there are a lot of brain changes that happen with gratitude that are all really positive and positively affect us personally, but also socially with others as well. How can gratitude affect our inflammation and stress? With gratitude, we have cortisol reduction. So, a regular gratitude practice can reduce cortisol levels by up to 23%. Our cardiovascular system, and primarily disease associated with our cardiovascular system, can be positively affected by gratitude. So, other cardiovascular effects and benefits that we get from a gratitude practice, we have improved heart rate variability with a gratitude practice, which heart rate variability sounds like a cardiovascular measure, but it really is that measure of how resilient our nervous system is, how easily it is able to flip between that sympathetic fight or flight response and that parasympathetic rest digest response. So, improving our heart rate variability with gratitude is obviously amazing, and it also indicates some nervous system benefits as well. We have improved blood pressure and health of the actual lining of our vasculature with a gratitude practice. And a regular gratitude practice also leads to better autonomic nervous system balance through activation of that parasympathetic, that rest digest part of our nervous system. So when we look at gratitude and its effects on sleep specifically, grateful individuals fall asleep faster and stay asleep longer. They have improved perception of sleep quality, improved energy, and they're thinking that gratitude can actually help in the treatment of insomnia. When it comes to biological and sex differences between how men and women both respond to gratitude, women have a higher baseline level of gratitude. So, a 2024 study analyzed almost 50,000 female nurses and found those with the highest gratitude scores had 9% lower all-cause mortality over 4 years and a 15% decreased risk of cardiovascular disease deaths. So, it's super cool that, of course, gratitude seems to be a mental activity, but it is very clear that gratitude practices also affect the rest of our bodies, the physical side of our health and wellness, whether that's through the brain and having different processes mediated through the brain, or whether it has direct effects on things like our cardiovascular system and our immune system. And lastly, a 2023 systematic review and meta-analysis found that people who performed various gratitude interventions had significantly reduced anxiety and depression, enhanced positive emotions and life satisfaction, greater optimism and appreciation, increased pro-social behaviors, which those are the behaviors where we are intentionally going out of our way to benefit others. They had less psychological pain and worry, improved therapeutic outcomes in those being treated for anxiety and depression. So I feel like that one wraps it all up, that gratitude practices are wonderful for us, no matter if it's gratitude experiencing, gratitude awareness, or gratitude giving. All of them are beneficial to us. This year, around that Thanksgiving timeframe, I also wanted to look into how female friendships are different than male friendships or relationships, and how females benefit from friendship differently than men in regards to overall health and brain changes. So for female specific, a woman's health generally benefits more from quality relationships compared to a man's health, but it is also more negatively impacted by social isolation. So on either sides of the extreme, we benefit more from quality relationships, but we're also more negatively impacted by social isolation. Women are better at providing social support, relying on social support, and disclosing important parts of their stories, which helps to build that social connection. So all of these are, of course, associated with friendship. High quality female friendships specifically lead to lower blood pressure, reduced cardiovascular disease, and a 60% lower chance of premature death. Quality female friendships can also help lower cortisol levels in women who regularly engage with their close friends. Dr. Taylor out of UCLA, who's one of the primary researchers in this field, found that when faced with external stress, women gravitate towards each other to help cope, while also taking care of others to help cope with that stress. So she called this way of handling stress the tend and befriend theory, or the tend and befriend way of handling stress versus the fight or flight response that we're all very familiar with, where women naturally want to take care of others, and we also want to befriend others when faced with that external stress, which I thought was interesting because I do feel like women in general are more open with each other, more willing to ask for guidance or help or sort of bond over challenges, which can be that befriend part of the equation. But I hadn't really ever thought about the tend part of the equation, where we, when faced with stress of any kind, we want to start to take care of others, which I feel like is a real special thing about being a woman, I guess, that when faced with stress, one of our immediate reactions is not to fight or flight, but possibly to take care of others, which I think is really beautiful. So Dr. Taylor says this whole process of ten and befriend is mediated by oxytocin release, which in turn can help lower our cortisol levels. It was fascinating to see the science of how we benefit from friendships differently than men and to understand a new theory of how we approach stressful and challenging circumstances due to the differences in how we as females experience friendship. Lastly, one of our most recent episodes, episode 87, we chat the neuroscience behind pain and how we should think of pain as an output rather than an input. People associate the pain they feel in a certain region with physical damage of the structures in that region or the structures that actually supply that region. And this can definitely be the case. If you sprain your ankle or there is some sort of physical damage to your ankle or a broken bone, you are going to feel pain because structures in that area are sending danger signals to the brain, and the brain is integrating a lot of different signals to create that output of pain. So there is some correlation, but it's not always the case. There are more complex networks involved in how our brain eventually tells us that we're in danger. The brain has to integrate a whole lot of inputs, not only the physical damage from the structures, if that's the case, but also our cultural beliefs, our past experiences, our visual inputs. It's constantly integrating a lot of different inputs in order to create that output that tells us that we are in pain. So one of my favorite examples to talk about this phenomenon is actually a researcher out of Australia, Dr. Lorimer Moseley, and he is one of the top researchers in this field of pain science, and he has such a wonderful way of explaining pain to where people can really understand what their body is going through, what their brain is going through, and how the two mix together to create this response of pain. So one of the stories he utilizes that I feel like is a perfect example, and I might paraphrase it a little bit, but there's one day where he's walking to the river, maybe with his friends, and he's out of Australia, so you can only imagine the terrain that he's going through, but his leg ends up touching a blade of grass or a shrub of some sort, ends up rubbing against his leg. And he kicks it off and continues walking to the river. He gets to the river, gets in, starts swimming. He gets bitten by a snake. Then he gets sent to the ER to take care of this poisonous snake bite that he just got in the river. He's all fine. He survives the snake bite. He survives the ER visit. But the next time he's walking to the river, his leg again feels that blade of grass, that shrub, and he is in agonizing pain. Just the most intense pain he's experienced from that same sensation, that same brush against the leg of that shrub or the blade of grass. I can't say it's the same one, but you get the picture. It's the same intensity of signal, but a completely different output because of his past experiences. How can that same blade of grass trigger a completely different response? His brain used past experiences as a way to protect him in the present. His brain had a previous experience of brushing against a blade of grass and then a subsequent ER visit after getting bit by a snake. So his brain takes that information and says, okay, next time that happens, I'm going to remember that experience and that ER visit and the poison and the trauma that was from that experience. I'm going to create a response that is going to elicit pain and let the body know that I'm in danger so that it doesn't happen again. So it wasn't just the input that created that sensation of pain, but it was also the brain integrating a lot of different components, especially his past experience of having that blade of grass brush against his leg and then ending up in the ER. So when we talk about the basics of pain in our nervous system, pain is not actually a sensation that we can sense. Our brains do not actually sense pain. There is nothing that happens in our body that says, oh, that was painful. What we have within our bodies are receptors and sensors that sense potential threat. And these are called nociceptors, and they sense a variety of potential threats. So we have receptors that sense mechanical threats like pressure or cutting, like slicing the skin. We have chemical threats, so acid or an inflammatory substance. We have thermal threats, too hot, too cold. And then we also have, of course, potential tissue damage like a broken bone. So if you experience low back pain, your low back alone cannot sense pain. It can only sense possible threat signals that are sent to the brain, where the brain can integrate a lot of different inputs in order to create a certain output. And sometimes that output is pain. So if you experience low back pain, your back alone cannot sense pain. It can only sense possible threats to be sent to the brain for the brain to decide what that response is going to be. Rather than thinking of pain as an input, oh, I have low back pain, that pain signal is sent to the brain. Think of it as an output where, okay, I've injured my low back. The nociceptors, the receptors that sense potential threat in my low back are sending signals and inputs to the brain, and the brain has to decide what to do with it. So after the signal is received, your brain actually integrates the signal with a variety of other brain areas and past experiences to create a response. The response doesn't have to be pain. It can be pain, but sometimes that signal is ignored. Imagine if you sat on your wallet, right? Your wallet is pressure. We have sensors within our skin that help to sense that pressure. If we sat on our wallet and it was painful every single time, that would be an issue. I know that's more of a guy thing to have wallets in their pockets, but girls, you have those little metal things in your jeans. That's pressure that our body senses. And if our brains sense that as pain every time, we would be not able to sit down in jeans. So instead, some of those signals are ignored, which is a good thing. Sometimes the brain also creates another response, like a muscle spasm, inflammation. It creates an altered movement pattern, like a limp or a compensatory pattern. If you roll your ankle, maybe you also walk a little funny to protect that area. Same with heightened awareness of that area. I'm sure if you sprain your ankle, moving that ankle in and out of bed, you're a little bit more aware of those movements to not move the ankle in a certain way that might cause you pain. So we can think of pain as one of the possible responses that our brain can help carry out based on the signals it is receiving from all of the receptors within our body. This should actually feel super empowering because it actually means that we can help to change those outputs. Our brain is sensing potential threats and danger, and its job is to protect us. This is a conversation I have a lot with patients because a lot of the time, as the clip shows, we associate structural pain with our body sending us pain signals, when in reality, our brain's job is to integrate a lot of different signals throughout the body. And one of the responses, one of the outputs that the brain can create is the response of pain. So pain really isn't sensed within the body, but it's a response to a variety of inputs that the brain is receiving. We covered so much of the female brain this year, and I'd say in general, these were some of our top episodes out of 2025. So I'm excited that we got to wrap up the year with a best of 2025 episode when it comes to the female brain. We'll also cover the female body and just top moments and top cool things that we've learned from throughout the year. We can look at these episodes as a book review or a podcast review over the entire year to sort of summarize all of the cool things we've learned about the female brain, the female body, and different fun facts we've learned from all of the guests we've had on the podcast throughout the year. So thank you guys for joining me for our first best of 2025 episode on the female brain. And I'll see you guys again on the next episode of Wellness Fixes the Pod.